San Diego's most popular local morning news. Good morning, San Diego.
Well, welcome back. A former beauty queen died recently after complications during plastic surgery. The former Miss Argentina, 1994. She was a mother of twins and died after getting cosmetic surgery on her buttocks. Plastic surgeon Dr. Richard Chafu is here this morning to shed some light on this situation. And there's a picture of her, just stunning. You know, you just wonder, some people just go a little bit too far. Good morning.
Exactly. Good morning.
Let's talk about the procedure that this beauty queen had. What is it called?
Well, actually, I think what she had done were injections of silicone, which were actually massive injections of silicone, which we know are illegal in the U.S. The FDA very carefully controls the use of silicone, and she probably had this injected into the subcutaneous tissue in the buttock area. Right. It can be injected into the thigh area.
And why do you do that? For
enhancement. It's a procedure that causes an immediate swelling in that area, so it makes an immediate result, but there are a lot of obvious serious side effects.
So it gives you kind of a J-Lo butt, for a lack of a better term. Just rounds you out, maybe firms you up. You know, we hear about the complications that can happen from any sort of surgery, but apparently in this case, the fluid went to her brain and her lungs, and she suffered, was it an embolism?
A pulmonary embolus, which is a catastrophic complication after cosmetic surgery, and probably the reason that she got that was that the injection went into the fat tissue, which has a number of blood vessels, got absorbed into the bloodstream, and then went back to the lungs, and she had a large embolus and died.
And I guess the question is, I mean, obviously this happened, we're assuming this happened in Argentina, and you said that if it was silicone, that's illegal in this country anyway. So I guess the standards are a little bit less in other countries?
The regulations are much different, you're right. We have very stringent regulations for patient safety.
And what about in the U.S.? So how common is this particular procedure? Are women still asking for it?
No, I mean, it's actually an illegal procedure. Certainly, there are this procedures called gluteoplasty, which augments the buttock area. The surgical implants, but they're solid implants, not liquid injections.
Right, and are those asked for on a common basis here in the U.S.?
Not commonly, but occasionally. It seems to be more of a South American tradition.
Right, so I guess the warning here is just another opportunity to warn people that you really need to consult a board-certified plastic surgeon for procedures like this.
Right.
Let's talk about something else that's in the news, and that is the 5% so-called Botox that is in the last 100 pages of the 1,000-plus page health care bill that the Senate is debating right now. I have a feeling I know how you stand on this.
Well, you know, it's interesting because my patients have actually told me their concerns about reading about it. There are people that, as you know, cosmetic surgery, most people that have cosmetic surgery are within the middle income bracket, and a 5% tax on something like that might be the difference between having a procedure and not. The other issue is that if you look at the bill, and I haven't read 2,000 pages, and I doubt that many of the senators have either, there is a concern about whether or not that tax will be part of the bill in terms of reconstructive surgery. In the bill it says clearly, well, only for cosmetic procedures, but you and I both know that in plastic surgery,
there's a fine line.
There's a fine line.
So somebody who has maybe a rhinoplasty, a nose job, because they have sinus issues, they could get taxed for that.
It could muddy the water. So it seems to be an unfair tax and something that doesn't seem to be fair to the average person who's trying to have something done elective.
Well, it's one of the many issues that will be debated definitely before next year. Doctor, thank you very much for shedding some light on this procedure and what happened to this Miss Argentina, and also for your thoughts on the Botox. Enjoy your morning.
You too, thank you.
A crowd came out